Hi guys, welcome to another interesting episode of my YouTube video. If you're a first time viewer, good to have you. I'm Nojud by name. On this particular YouTube channel, you'll be coming across interesting videos, content on nursing practices in Nigeria. And also, I still do vlog about myself. You'll be given a wonderful opportunity to know how a nurse spends his or her day in Nigeria as a nurse. So that's just that. So on today's video, I'll be strictly focusing on the newly upgraded program in nursing college in nursing. So I'll be giving you a detailed explanation, things you need to know about the new program and how the new program is being operated in various colleges of nursing in Nigeria. Stay tuned as we continue. So we actually know that this admission period and many aspirants are great expectation to gain admission into various college of nursing in Nigeria. And we know how the tension rises when you get to this particular phase of gaining admission into college of nursing. But mind you, college of nursing has been upgraded as I did in my previous video. If you're yet to watch the video, check on the channel and you'll see the video there. Watch the video and know how the program is being done. But this video, the detailed explanation on how the HND program is being carried out in School of Nursing. So firstly, I'll be clearing the air on the fact that when studying nursing currently in College of Nursing, the first thing they have removed in the system is the use of entrance examination and interview to screen aspirant into various college of nursing. Yes, this is not a new news any longer because of the increase or the upgrade in the program by the Nursing and Midwifery Council of Nigeria. So that is by the way. So ease your mind, just remove your mind from the fact that there is no more interview. And again, how is the admission process being done? With the little knowledge I have, the admission is strictly based on merit, and the school have less influence when it comes to giving admission as compared to when it was School of Nursing. Where you'll be getting your admission letter from is from the JAM portal. So the Joint Admission and Matriculation Board, JAM, they'll be the one granting you admission and you'll be accepting your admission via the portal. So there's no need for interview. That's just the first fact. So I've cleared the air about the interview aspect. No more interview into College of Nursing. Now, another question: is there PTS and withdrawal? Yes, this is a very, very tricky question. It depends on the institution, but on a normal scenario, on a normal circumstances, there is no withdrawal. That of PTS, there is no PTS entirely. There is no PTS. Everything you are doing it per semester. Whatsoever thing you are studying currently in College of Nursing is being studied per semester. So in each year, previously in School of Nursing, they study nursing six months, every 6 months, then you are entering your second semester. But now a semester is just about 3 to 4 months. You're already done with a semester and you're entering the next semester. And in a year, we have 2 semesters with one clinical posting. That's how it's being done. 2 semesters at the end of the second semester in each year, you're going for a clinical posting. At the end of each semester, you're going for a clinical posting. That's how the program is being done currently in College of Nursing. So another interesting question I'm getting here is, how does the school intend to grant certificates to their students? How the program, 4 years program, is being slated into ND and HND? Yes, let me answer that particular question. It's a very good and interesting question. I'm getting the question from various aspirants. So now we know the program is a two joint program. The ND program, which is being studied for 2 years, and the HND program, which is being studied for another 2 years. Then at the end of the day, you graduate as a registered nurse. So let me explain how the ND program and HND program is being splitted within that 4 years of studying. So for the ND program, we have the 100 level and the 200 level. Within the 100 level, we have the 100 level first semester, 100 level second semester. Then ND1 is you are done with ND1. Then you go to your ND2, which comprises of ND2 100 level, ND2 first semester and ND2 second semester. Then you're done with the ND2. Then you're entering the HND. That's how the thing done. The HND, you have the HND1 first semester, HND1 second semester, then HND2. HND2 first semester, HND2 second semester. You see how the program is being done. So within this HND1 and ND1, any of them, within this, there are different interval of community posting, clinical posting within this program. Most especially importantly, before I forget, within these two programs, this College of Nursing students will be given that opportunity to write council exam twice. Yes, get me right. Before in School of Nursing, they normally write council exam once at the end of the third year as a student. You just write your council exam, you get your RN, you are done, you graduate. But now you are writing council twice. That's how interesting and how cumbersome and how advanced the program is currently. Before, when you study nursing, you just study nursing year one, first semester, year one, second semester, year two, that for year two, similar thing for year two, year three, at the end of your year three, second semester, you are writing your council exam, you are getting your RON and leaving. But in your HND program, at the end of your year one, at the end of your MD2 second semester, the student will be writing council exam. That's just how the thing is. You're writing your first council exam. So if you pass your first council exam, we determine if you are moving forward to ND2, HND1. I don't know if you understand. If you pass your first council exam, then you'll be given that opportunity to advance to HND1. So at the end of HND1, then you write another council exam. They'll be granting you, I think within that council exam, you'll be given the opportunity to get this particular HND certificate and your RON. And so you have your RON. I think that of the ND2, you'll be getting out of your ROM, but you'll be getting one certificate within this four certificate that the school will be issuing, which I mentioned in my previous video. If you don't know about the four certificates, go back to the previous video and check on them. You'll see the four certificate that's being issued by College of Nursing currently. So within these four certificates, within that two council you are writing, two certificates will be issued, and at the end of the other HND2, another two certificates will be issued, making a sum of four certificates. That's how the program is being splitted currently. So you see how cumbersome within the interval. Imagine students from School of Nursing writing a particular council exam when they have been given thorough classes from year 1 to 300 level and they're writing one council exam. So imagine you're writing a council exam from just year 1 to 200 level, you're writing a council exam. So you'll be up and doing. If you're coming to College of Nursing, just know you, it's not a place for play. You'll be up and doing, you'll be willing to learn at every given point in time. There is no break in College of Nursing. I see my colleagues in universities, not in nursing program entirely, but I see my colleagues in university, they'll be giving that 3 weeks, 1 month, 1 month plus break. I'm like, wow, you guys are really trying. The school literally opened their eyes and they are giving 3 months break. In School of Nursing, or rather College of Nursing, the highest break you'll be getting for months is just two weeks break. At the end of every 2 weeks break, if you are even living from a very distant place, you will not be given the opportunity to go because of the distance. But if you are getting that 2 weeks break in each year, so imagine you are having the whole of 12 months in a year, and in each semester you are given just 2 weeks to enjoy. So at the end of 1 year, the sum total of the break you'll be getting is just 2 months. If it's over up to, because each semester you're getting, so at the end of, you'll be given just 1 month, sorry, at the end of 12 months, 12 months in a year, you'll be given just one full month to enjoy. So you see, the hustle is really, really real in nursing entirely. Actually, I had no intention to make a very long video on this particular topic. I never knew it's this elongated, it's this long. So the last question I'm having on my screen here is, does one necessarily need to go back to 200 level in university after studying in College of Nursing anymore? Yes, very good question. Yes, not the answer, but a very, very good question. So now at the end of the whole thing, at the end of the HND last semester, which is the HND2 last semester, you are graduating. After graduating, you'll be going for your service. You'll be serving the Nigeria Youth Service Corps. So at the end of it, or if you want to upgrade your certificate, because now you are having HND certificate. So if you want to upgrade your HND certificate, you don't really need to go back to 200 level. Don't, that misconception should be removed. You don't need to go back to 200 level to get as to upgrade your certificate to a bachelor in nursing sciences anymore. All you actually have to do is just to go for a pre-degree program. You're going for a particular pre-degree program for just a year. At the end of the year, you'll be giving your RO, you'll be giving your BNSC. So that's just the whole thing about the whole program. So in conclusion, studying nursing in College of Nursing, is it worth it? It's really, really worth it with the upgrade currently. It's really, really worth it. The stress is there. The stress both in university and colleges. First of all, the course is not an easy course. You think you just go in and just come out, do it one day, two, you are done, and you're having your certificate. It's not an easy course. You need to work for it. But at the end of the day, it's not easy. But studying nursing in colleges is worth it. It's really, really worth it. It's really worth the experience. It's really worth the time. And professionally, when you start practicing, it's really worth the stress. Thank you once again. If you're yet to subscribe to the channel, hit the subscription button. Don't forget to turn on your notification bell to get notification when a newly released video is being dropped on this channel. Good to have you once again. I'm Nurse Jude. Bye.